presentation of Medicare Open Enrollment and Medicare Scams and Fraud Prevention. My name is Nia Murray. I am the Programs Coordinator with Neighborhood Recovery Community Development Corporation. And we are here today with representing with a representative from the Harris County Area Agency on Aging, Ms. Maria Angel Romero, who's going to be providing the information for you all about Medicare open enrollment and also some scam and fraud prevention tips. So as part of our senior security series, there's a variety of different workshops that we will offer within this series as it relates to Medicare, elder law, scam and fraud prevention, a lot of things, retirement, Social Security, disability, all of those different kinds of things that are included in the senior security series. So we wanted to make sure that a lot of folks that don't have access to a lot of information or don't know where to go for particular resources or know how to access a lot of information, that we provide that information to the community, because especially something as important as Medicare and Medicare open enrollment, that stuff can be confusing, extremely confusing. So I remember when I was going through this with my dad when he was trying to enroll, I knew it was confusing for me, and he's much older than I was, so I can only imagine, a senior, what that process would be like for them. So I know the good folks over at the Harris County Area Agency on Aging offer assistance with that when people have questions about Medicare open enrollment and other services that they offer. So we partnered with them today so that they can provide you guys with this information for us. So on behalf of Neighborhood Recovery, we want to again thank you guys for joining us this morning, and do apologize for the technical difficulty and the delay. But without further ado, we're going to go ahead and get you started. Again, we have Ms. Maria Angel Romero with the Harris County Area Agency on Aging, who is here to provide you guys with information. Do know that we are broadcasting live on our social media platform, as well as recording our presentation so that you can go back and watch the presentation again, or actually share the information with whomever it is that you know that may want this information and feel like this information would be beneficial as well. So do keep in mind that when you are, we invite you to ask whatever questions it is that you have, but we do want to try to protect your privacy as best as we can. So we ask that you don't divulge any personal detailed information, because we are on a public platform and we are recording the session. We don't want that information getting out there. However, we do have the expert in her field to provide you with this information, with whatever questions that you have. If you are joining us on Zoom, please feel free to type your question into the chat. And I'll definitely make sure that we go over the questions at the end. You also have the opportunity to unmute yourself and ask the questions directly of the presenter, and she can answer your questions there as well. If you are joining us on our social media channels, please feel free to type your questions into the comment section, and I will be monitoring those questions as well too, so we can get those things addressed. So again, without further ado, we're going to go ahead and get started, and I want to go ahead and introduce Ms. Maria Angel Romero, who's going to be providing the information for you.
Good morning, everybody. Good morning in person. My name is Mary Angel Romero with the Harris County Area Agency on Aging. I'm also part of the Houston Health Department with the City of Houston Health Department. So I'm gonna actually briefly discuss what we do in our agency. The Harris County Area Agency on Aging actually has been a part of a nationwide federal grant program authorized by the Older Americans Act of 1965. In our agency, we have the agency all throughout Texas. So our agency only responds to Harris County, but we also have the sister agency, the Houston Galveston Area Council, and they offer services throughout the entire other counties that we don't respond to. So we're talking about the other 12 counties that we don't typically help out with. We only concentrate in Harris County. So the Area Agencies on Aging has 28 triple A's, we call them triple A's, in Texas. So you know that if you do decide to move outside of your area, you do have other area agencies on agents that can assist, okay? So what do we do? The Area Agency on Aging of the Harris County, we offer assistances for older adults 60 and over that lives in Harris County, and some of these assistances are a temporary based. And of course, we'll look at all of your criteria, we'll look at all of your information, and we determine, what services, you're eligible for. So always feel free to call. We're always there to have the call center respond to questions and, and of course, whatever assistance you may need, we might not assist you with, we may have those resources. So still give us a call. And I'll give you the number after I do my presentation so you can have that information on you. One of the assistances that we do is benefits counseling. That's what I do. Benefits counselors do help out with the Medicare questions, those Medicare questions that are very confusing, especially whenever you're doing open enrollment. Open enrollment starts October 15th. It just started last month. It runs to December 7th. So this is the chance that you guys do have to make those changes if you want to make changes to your plan, review your plan, or to see what's out there, what's out there for you. Okay. You don't have to necessarily feel that you need to change, but of course, thank you. You don't necessarily can you hear me? Is that okay? Sorry, guys. Yes. Hello. 1, 2, 3. Can you hear me? Yeah. You can hear me? Okay. So you don't necessarily have to make any changes to your plan if you don't have to, or if you don't want to. A lot of people respond to the fact, do I need to make any changes to my plan? No, you don't have to make any changes to your plan if you're satisfied with your plan. But we always like for our clients to know that there is availability out there for you to find out if there are any plan changes for the upcoming year. Okay. So our agency is very busy during this time. So sometimes, we get bombarded with all calls throughout the 2 months of October all the way to December. So it is very busy at this time of the year. So of course, we offer other services in the AAA. We offer assistances with hearing, vision, dental. Some of these programs do have a waiting list. They are free, again, free services, temporary assistance to our seniors 60 and over. Okay, so you always are welcome to give us a call to find out more about the services that we offer. We also offer transportation, residential repair, emotional wellness and support. We still have some assistance with income support, that utility assistance. I wouldn't call it utility assistance, just basically income support. They look at the criteria, see what they can help you with. If you need assistance with your medications, if you need assistance with maybe paying a light bill, as long as you meet the criteria, they should be able to assist you. Okay, again, it's not something permanent, it's temporary. So make sure that you understand that we provide that temporary assistance, a temporary relief. But when it comes to permanent solutions, we always encourage you to look for other solutions. Okay. We also offer the congregate sites. We do fund the nutritional program, through the Meals on Wheels and the congregate meals at all of our MSCs, the multi-service centers. So those are available to you at no cost as well. Okay. We do care coordination programs. So those that are needing assistance with respite care, or someone in the home to help you out for a few days because you can't take a shower, you can dress yourself, you need some light cleaning, light cooking. Those type of services are available. There are services through the state that you may be able to qualify for. Again, those are criteria based. The state provides long-term care services, but again, you have to meet those criteria from the state to see if you qualify. Okay. We also do the adult day centers. We also offer the adult day centers. Those are available to you as well if you are or your loved one is suffering of dementia. You know, the day centers are there for you to have some kind of, kind of daycare type of activity that you can take your loved one and they can interact with other adults. Okay. We also have the emergency response, or what is well known as the life alert button. So that life alert button is always good to have for you in case that you are a person that suffers vertigo, you fall quite a lot, and you just live by yourself. And honestly, you don't have anyone to call in case of an emergency. So the life alert button is also there for you. I do have to say this as a Medicare benefits counselor, I'll also encourage all my clients to look at the benefits through their Advantage plan. If you do have an Advantage plan, not the traditional, but the Advantage plan. The Advantage plan offers some of these plans do offer some of these services like the life alert or home notifications. I encourage you to check what your Advantage plan may offer, okay, and take advantage of those. All right, we're also offering something called social reassurance. This is a very fairly new program that it's piloting in the agency right now. We're providing regular contact and companionship with an older person by means of telephone calls, texting, or video chatting. So someone from the agency, is designated or assigned to this task to call someone every day, and talk to them for a few minutes and just see how things are going. What do you need? What's going on out there? What's going on with you? How you're feeling, just to reassure you that someone is out here listening to you. Okay. So take advantage of that as well. The caregiver support, like I said, the respite care program is there. Temporary relief for those caregivers, including an array of services provided to depending on older individuals who need supervision. So the respite care services are available to those caregivers of any age that is caring for the older adult, at home and is needing some kind of a break, from the job that they're doing. Okay, so those are some of the services that we offer in our agency. I will ask Nia to actually submit this information to you via email if possible. But our phone number is 832-393-4301. And I don't know, Nia, if you can put it in the chat for me while I'm talking. 832-393-4301. That is the area agency on aging in Harris County. Okay. All right. So what we are here for, the wonderful Medicare side. Okay, the Medicare stories, that we deal with every day. So Medicare is very complex, guys. I have to say that Medicare is difficult to understand, and we understand that sometimes you don't know where to go. So one of the things that we are thankful for is that we do have the Harris County Area Agency on Aging to provide the SHIP program, the State Health Insurance Program. Okay, so in the back of your Medicare book, if you do have a Medicare book, which usually the Centers for Medicare and Medicaid will send it to you every year. This Medicare and U book, I don't think that you guys can see it on my screen, but over here on the in person they can. The Medicare and U book always comes in the mail to those seniors, every year. In the back of the book, you'll always find the number 1-800-252-9240. That's the SHIP for Texas. Okay. The SHIP for Texas allows you to connect with one of your state health insurance program, SHIP, to personalize or to have a personalized counseling with the benefits counselor and discuss your Medicare questions and concerns that you may have. So that's what we are. We are the state health insurance program through the Harris County Area Agency on Aging. Again, city-county partnership through the Houston Health Department. So that's a lot to remember, but just know that, we are here to help you. So we understand original versus traditional versus advantage plans. Of course, some of the people that have the original plans, they want to change into the advantage plan. I always have to say this: when you have a traditional plan, you understand that you are more than welcome to go anywhere you want to. Okay, when you enroll, you have to enroll in your Part A, or your Part B is given to you, but also your Part D. You have to enroll in your Part D, which is your drug plan. If you miss that open enrollment for your drug plan when you're first eligible, you are subject to penalties later on if you ever want to get it, while you have traditional. I have an example of a client that had Part A, Part B, but did not have Part D. The person was 72 years of age, and unfortunately, that person was facing penalties because they did not sign up when they were first eligible. Same thing goes with the Medigap plan. Medigap plan is something that you go into when you are first eligible. Okay, so if you wait it out and time passed by and you want to get that Medigap plan, you may face into some challenges. I'm not saying that you might not get it, but I'm not saying that you might, because the insurance companies, they can say, you know what, I'm going to put you on underwriting, which means I'm going to ask you a lot of health questions. And because you're 72 years of age, you might be facing, a denial or extreme, high rates, a premium rate, and that's what we're facing right now when a lot of seniors wait until the very, very end to get into the Medigap plan. I do have some clients that have gotten it, and I have some clients that they have gotten denied because of the underwriting. But again, if you are 65 out there and wanting to get enrolled into a plan, do it while you're still eligible for it. If you are in an advantage plan, well, you understand the advantage plan, has a combination of the Part A and Part B. Okay, the Part A and the Part B, hospital insurance, Part B medical insurance, and a combination with the Part D. Not every advantage plan offers the drug plan, but most of the plans they do. Okay, so take advantage of looking at those and the cost, what the cost means for you for the upcoming year. Okay, and again, every year you have the right to look into your plan. Every year you have the right to know what changes are coming into your plan, what's out there, what's new, what's offering, if they're taking services, if they added value services. You are more than welcome to call your plan and find out what the changes are for the year. However, the plan or Medicare does have the right to send you an annual summary of notice change, which allows you to know, what changes are coming for the upcoming year. Okay. All right. So with the Medicare Advantage plan, I get a lot of questions. Can I have a Medigap with the Medicare Advantage plan? The answer to that is no. You cannot. You cannot. That's just a simple answer. You cannot have both. Okay. I do say this: a lot of people that have the Medicare Advantage plan, and if you do qualify, you can always apply for the Medicare Savings Program, which is a Medicaid-based. The Medicare Savings Program allows you to, or helps people with, limited income and resources to pay some or all of the Medicare deductibles. They have 4 different programs within the Medicare Savings Program, and the most that pays all the 20% is the QMB. That QMB, it has its limits income guidelines that you have to go through, but it is the only one out of all the four that pays for the 20% that Medicare does not pay for. What's the 20%? The co-insurance, the co-pays, the deductibles, and and so forth. So, if you do qualify, always, contact our agency to see if you actually do meet the criteria for the state. The Medicare Savings Program is a Medicaid base, so a lot of people say, "Oh, I have Medicaid." Technically, it's not Medicaid. That's what one of the representatives told me the other day when I was saying, "Well, they have Medicaid," and they said, "No, it's technically not Medicaid. It's called Medicare Savings Program." And I said, "Okay, well, this is still through Medicaid. It's confusing, but we're just gonna call it Medicaid, okay?" So for the heck of it, we're just gonna call it Medicaid, but it is a form of Medicaid. Medicare Savings, again, has four different programs, and the limitations are, different for all of the programs. The income guidelines are completely different for each one of them. So every year they do change. Just because you didn't qualify one year doesn't mean that you're not going to qualify the next. I still encourage every client to make sure that they do have, they call the area agency on aging or they call the state to find out if they meet that criteria for the program. Okay, because every year the income changes. Okay, the income guidelines change. So what we know about open enrollment, it starts October 15th through December 7th. When does your coverage start? Your coverage starts January the 1st. Okay, I get a lot of people that because they have this coverage, they can change and they start right away. No, the answer is no. It's not going to start right away. It is going to start January the 1st. Every time that you do open enrollment, every time that you are in the open enrollment period, you are looking to change or review your plan. But if you decide to change, it will start January the 1st. Your coverage, your current coverage is going to end December 31st. Okay. So you're not going to have any gap in coverage if you decide to change plans. Okay. Again, the enrollment period, allows you to review your coverage, check your plan's formulary, evaluate your healthcare needs. So make sure that you take advantage of that. I can say this, I was looking into changes for this upcoming year, and we do have some changes. We do have some changes for the 2026. One of the actual changes that I have seen is the prescription drug deductible. The prescription drug deductible it's actually a little higher or higher than last year. Some people had no deductible whatsoever last year, and all of a sudden they're hit with 200, 300, 500, 600, deductible this year. Why? The medication formula, so the tier of the medications have changed. So the higher the tier of the medication or the medication in the tier, the higher you're going to pay for those medications, okay? One of the things that I read and I put on my notes was the new final rule for Medicare Advantage Part C and D. Centers for Medicare and Medicaid Services released the contract year 2026 policy and technical changes rule. It affects how the Medicare Advantage and Part D plans operate, changes to supplier, pharmacy, network, and data reporting rules. So all of these are factors, for seeing all these increase or increments, okay? Prescription drug plan, Part D, the annual out-of-pocket cap for coverage drug is going up for 2026, okay? These are also factors of the fact that, we're seeing a lot of these changes. So no cost sharing for certain adults. Let me see, let me go back. under Part D and cost sharing limits for covered insulin. So, those are some good changes, but at the same time, some other, prescriptions are going to be hit with those high prices. Okay, so you always have to look at your formulary. I had a client, actually, I had two clients yesterday that were just put on, was it Eliquis? Eliquis, yes, they were put on Eliquis. Well, Eliquis is one of the higher ones that are getting hit with high prices. Last year may have covered some, but this year the company is not covering as much. So that's what I'm seeing on my side, with the prescriptions, for the 2026. Okay. I do see here that those that are on dual eligible, there are some changes or enhancements. The dual eligible in special needs plan, I'm guessing those are the ones that have Medicaid, Medicare, and let's go back over here real quick. And it says for dual eligible enrollees, there will be rules to better integrate Medicare and Medicaid coverage and member identification. What that means is it's basically, they're trying to better, both of the services, and they're trying to add more added value benefits for you or for those that have dual eligible program. So I will always call the dual eligible plan. If you have a special needs plan, call it up. Okay, call it up and find out what the changes are going to be for those particular plans. All right. All right, that is that for the medications. So you are whether you're switching, changing, or enrolling, it is always the best to always look at your plan, see what your plan is changing for this upcoming year or for any year whatsoever. Every year is different. So understand that you have those options for you available. And again, you can call our agency and you can call Medicare. Medicare is open 24/7, 24 hours, 7 days a week. Best time to call Medicare when we can't get to you. The best time to call Medicare is always going to be in the afternoon, late at night, if you like to stay up late. I know I like to stay up late, so if I had other agencies that open 24/7, trust me, I would be calling too. So take advantage of that. When the area agency on aging gets bombarded, usually between now and December 7th, is when we are hit the most, with clients calling, and of course we get saturated, and it's hard for us to call everybody out. We wish we could, but we're gonna have to stop at some point, and then we refer them to Medicare. That's why it's very important to have Medicare phone number available, so you can you can contact them. So I know with Medicare phone number is 1-800-633-4227. Again, 1-800-633-4227. And again, they're open 24/7. Okay. I'm sorry. Medicare directly. Yeah. 1-800-633-4227. So we did talk about the Medicare Savings Program. Do know that even if you may not qualify, don't get discouraged. Sometimes the state is very strict when it comes to their income. Okay, and again, income guidelines change every year, so don't get discouraged. Okay. Another option that I found out, I didn't know about this myself, but Medicare has a prescription payment plan. I'm not gonna go too much into it because I really, don't know much about it. I haven't had a client that has used it just yet. But what it says here, it says allows beneficiaries spread their out-of-pocket prescription drug costs. Instead of paying at the pharmacy, your plan will send you a monthly bill. program is available to all beneficiaries enrolled in Medicare Part D and Medicare Advantage plans, okay? So this goes through your plan. If you have such a medication like Eliquis or any other medication that may exceed 800, 900, I have seen clients paying almost $1,500 for just one medication. Yeah, it's insane. It's insane. And they have to go, find other resources, So we gave them this information. Again, I haven't had a client try it out yet, but we have given it out, and that's why we're giving it out to you. It is through your plan. You contact your plan, you let them know, hey, I was just prescribed a prescription that it doesn't look like my plan is covering it, or if it's covering it, it's not covering much, So is there any way that I can qualify for this medication, for this Medicare prescription payment plan? They'll be able to let you know. Okay, so always contact your plan for that. Okay, I think that at this time, that it is for Medicare. For Medicare, I don't think I have anything else. I was trying to see if I had anything else to give out or any updates, but at this time, I think I'm done. Are there any questions or any questions in the chat? ARP is United Healthcare. Okay. Yeah. Second. Mhm. Yes. So did you disenroll from his?
Can you repeat the question?
Yes. So the question was, she is in United Healthcare, ARP, Medicare Advantage, and also was with her husband under his insurance plans through the job. So the question is, how does she get back to where she had? Did you have both? For years, she had both. Okay. Mm-hmm. Mm-hmm. Right. Okay. What did you have with his insurance? What do you have? So typically, guys, this is very common too, where everybody, people are about to retire from a company and they have insurance through their job. Sometimes I see people that they do go with Medicare, okay, and then they also stay with the job plan instead of switching, to Medicare. Oh, wait until you completely retire, okay? When people are going to retire, a lot of people get confused and they think that, oh, I have to get on Medicare because if I don't get on Medicare, I'm going to be penalized. As long as you're still working and you have credible coverage, you don't have to switch to Medicare. You can get Part A because it's free. Why not? Why not have Part A? And yes, it will be that primary will be your job insurance, not Medicare. Medicare will pick up. But why not have it? When you retire, then you let Social Security know that you are about to retire, that you're about to, go ahead and finalize the last days of work, and you want to get on Medicare Part B. That's when you do it. He was on full Medicare. Okay, so he was paying two premiums. Okay, for that 1 year. Mhm. Mhm. Okay.
So you want to know, how do you get back to Medicare being the primary and United Healthcare being the secondary?
I will have to actually talk to you more about that, because that's a little bit more of a complicated situation.
Does that happen often, where people, when they retire, that it switches them from being that their job or their other private insurance becomes the primary and then Medicare becomes the secondary?
Well, on my side, I don't know if the benefit counselors will have a different, what I've seen is that they do go into their Medicare without knowing that they can delay it. So then they have two insurance. I mean, if you do have the money to pay two premiums, guys, I mean, you can, you can, but I always see that. I do see that with a lot of my clients. I can't say not all that I see it all the time, but I do see sometimes I do see some of the clients going into Medicare when they're still working and they're paying those two premiums. So sometimes it can be a little challenging when it comes to, okay, I'm now going to be full Medicare when I retire. So depending on what insurance you have, especially if you were on TRS, TRS, you can't go back if you go back into Medicare. If you go full Medicare, some people decide to stay with their TRS. Some other insurance, it just depends. It just depends. Right? It depends. Yeah. But I mean, if your job does not offer, like the city of Houston, for example, city of Houston offers a plan for the retirees that you can stay on after you retire. Okay. It's up to you if you want to switch into Medicare and stay with the city plan. Okay. But not every company offers that. And that's when you have to start thinking, do I want to go full Medicare? Or, some people don't even think about Medicare and they go into Cobra. I have had a client that went into Cobra, and you can imagine how much money he was paying. So yeah, it can be very, challenging trying to maneuver, two insurances. So yeah. Okay, but I'll look into it.
So do you recommend, before somebody actually even signs up for Medicare or any of these plans, that they sit and talk with a counselor first,
Yeah,
so that they get an understanding of
absolutely.
what they're doing?
Yeah, absolutely. That goes for anyone in the workforce, from TRS, people in the railroad retirement, people in the Social Security. I mean, everyone needs to talk with a counselor, with a Medicare counselor, to kind of go over the options, because a lot of people don't know that this exists, that we exist, or that Medicare can answer those same questions, So yeah, it's always very important to plan before you act. Yeah.
But not with a Medicare insurance provider, because they're pretty much going to try to sell them on their plan.
Yeah.
So an
Yeah.
independent kind of person or agency
Right.
versus
Right.
a plan provider.
Correct. Yeah. Medicare, plans are going to be there to sell their product, So, I mean, yeah, you can call about the plan once you know that you are looking into their plan. Like I do 3 plan comparisons with my clients, every day. So I do their 3 plan comparisons. I send them those. I tell them, what I see that can fit their needs. And I tell them, if you want to know more about the plan, call the plan and you can ask questions to the plan. Because sometimes we don't see, or we don't look into Medicare.gov. Sometimes I go into the plan website just to see, what other benefits are available. But if they have more specific questions, I always direct them to the plan. Yeah.
What are some of the most common mistakes that you see when people are signing up for Medicare, or, and I keep getting Medicare, when they're signing up or enrolling, or what are the most common mistakes that you see?
the most common mistake is usually not knowing where to start. They don't have a clue where to start, so they don't know who to call, and they end up calling. Unfortunately, the most common that I have to say that I have seen is that they answer those calls, every year that they get bombarded with, and they start answering those calls. Oh, so and so called me, or so and so did this for me. And those are very common mistakes. If you do not get the proper counseling, the proper advice from an expert, you are going to be confused. Even if you are already in Medicare, I suggest not to talk to anyone that calls you on the phone. Okay. Oh, we have this plan and it offers a U card for $500, that you can get. You're eligible for $3,200 over the counter. Guys, no. Don't fall for this. This is a lot of there are a lot of scammers out there, and your Medicare number was changed for a reason, because if you do know, Medicare used to use your social security number back in the day with a letter behind. No longer, thankfully, no longer the case. But your Medicare card number should be protected at all times from these scammers. Every year you will get bombarded, and a lot of clients end up changing their plan without really understanding why they even changed it. Okay, so these are common mistakes that I see people with before Medicare and after they have enrolled in Medicare. So just be careful with those phone calls. If you are in doubt, again, you can always contact your area agency on aging, or you can contact Medicare directly to answer your questions. Okay.
What are some other common scams that people fall victim to as it relates to Medicare
Other
and,
scams that I
and
have
fraud?
seen, other scams, yeah, I think I've seen the is it incontinence supplies? I do believe that incontinence supplies I have seen a bunch of scams when it comes to incontinence supplies. Of course, a lot of people, let them know, hey, you can get this. I think I had a client not too long ago actually with a scam on their um, summary notice that he didn't know where it was coming from, and it was from incontinence supplies. He didn't order them. So somehow his Medicare was charged with something that he never got. So of course, when that happens, we always encourage to report it, and there is the Texas Senior Medicare Patrol. I don't have the Texas Senior Medicare Patrol, but the Texas Senior Medicare Patrol, they actually respond to those that have issues, with summary notices, and they have been wrongly charged for something that they've never gotten. Okay, that's Medicare fraud. And anything that you don't recognize on your Medicare summary notices, please report it. Okay, because these are Medicare fraud. If you've never gotten a product, another one that I had was some service she had. It was in a different date. It was on a different date. I can't recall because it was a little while back, but I know that it was a different date. They coded it differently, and they charged her more. That is also Medicare fraud. And I asked her to report it because she had her statement where she actually paid her copay, and then they told her what the actual price was. She made the copay, but then she realized on her Medicare summary notice that it was coded completely differently than what she went for. So I asked her to, I suggest her, go ahead and call the Texas Medicare Senior Patrol, the Senior Medicare Patrol, to see if they can help and if they can actually, do something about that. But to me, it was fraud. Okay. So just be careful when it comes to your Medicare, to answering those phone calls. Sometimes text messages also, your text messages, they will get you. They will get you no matter, what you have. They'll get you through your phone, they'll get you through your textings, they'll get you through your emails. So just be careful in what you click, who you respond your phone, or who you give your phone to, and who you answer to. And if they start asking questions that you're not comfortable with, you know what? I got it. I'll call later. Thank you so much. Appreciate it. And hang up. Just hang up. Because unfortunately, the scams are out there a lot. Oh, yeah. Yes. Another one that I kind of popped out while you said that, it was the Social Security. I don't know if you ever, or if you or anyone else had a call from Social Security Administration, quote unquote, Social Security. Social Security does not call you unless you call them. If you call Social Security and Social Security does not, they have a wait line, they'll tell you, there is a long wait line for you not to wait in line. We'll call you back when your turn is up, and they'll call you. It'll take a while for them to call, but they'll call you. Only if you reached out to them and you gave permission for them to call you. But they're not going to call you out of random. I have heard, and even myself, I got one last year. Your social security number has been compromised. Please press 1 for, to speak to an operator. No, I am not. So just be careful with those calls, because, they'll tell you Social Security, they'll tell you it's Medicare, they'll tell you it's your plan. Do not answer, just hang up the phone, because they're not going to call you out of random. They're not. Okay. Yes. Right. No. 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 Don't answer. No. Don't answer. I mean, if sometimes they'll send communications. They will send communications, but yeah. Right. So she's talking about Social Security, that she gets a lot of emails, from Social Security. So she's wanting to know, um, what email, can you actually see that it is Social Security? Social Security, normally when you give out your email, especially when you register for their My account, every now and then they'll send emails for just information only. Now, if you do see something that has your actual name, I will call first before clicking anything. Okay, I wouldn't click on it, even if it was from Social Security. I would just call and say, look, I received this email with my name on it, blah, 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 and I just wanted to verify with you. Did you guys send that information or push that information to my email? And they'll usually pretty good about checking that. So yeah, don't fall into those scams of emails. Email scams is very popular too. So be careful with when you click something. Okay.
What does someone do in the event they have become a victim of fraud or scam? Where do they go to? Is it the Texas Patrol?
Yeah, the Texas Senior Medicare Patrol. Yes, yes, definitely. That's the number one agency that we, provide. The other one is the Better Business Bureau. That's another one that you can always contact as well, the Better Business Bureau. So those two agencies, and actually the Texas Senior Medicare Patrol, I think, is working with the Better Business Bureau, if I'm not mistaken, or is part of it. It's easy. I've seen it quite a few times, and I started this role because I've been a Medicare benefits counselor for a while now, but fully I became on board about 2 months ago, actually, in August, 3 months ago. So I became full-time benefits counselor, and I have seen it already. I've seen it about more clients calling me, well, I don't know who switched me to this plan. I don't like this plan. And I was like, okay, did you, by any chance, did you talk to a broker? Hell, I remember somebody called me. So trust me, you're not gonna be switched just to be switched. You had to be talking to somebody for them to switch you, and something caught your attention. That's what happens, that something caught your attention when you decided, oh, okay, well, let me try it out, and then you get switched. But guess what? You probably didn't receive what you were promised. The $3,200, that you were promised, you did not receive it, and that's why it ends up being a problem for the seniors, because when they go to their doctors, guess what? The doctor does not take that plan. So I have seen it with some clients already, and we had to call back, it's a whole ordeal trying to call back the insurance, we call back Medicare, we let them know, hey, senior was contacted by a broker or someone from the plan or from a different plan, and they switched them. They switched them, but they really didn't understand. They didn't really fully understand what they were switching to. So yeah, we can probably change back, but it's not going to be an easy thing to do either. So if we can prevent, not to talk to just anybody, that will be better.
What's the process for getting an agency, somebody like you guys, to help them with?
Absolutely, yeah. Our phone number, and since you're here, my dear, I'll give you one of these. I'll give you one of these before we go. But our agency it's open to you guys, and it's just, don't call us just during open enrollment. We are pretty much active all year round. We're active all year round for any questions that you may have. If you run into an issue with your insurance, if you run into an issue with your summary notices and something is not looking good in your summary notices, we can help, and we can guide you on how to start the process of, whatever the situation might be. We also assist with appeal process. So that's another, we assist with the appeal processes. So, hopefully we never have to see, I have never seen appeals go past phase one, other than just calling insurance or Medicare directly and getting it resolved. But some appeals take longer. So we do help with those. Yes.
I'm going through the social media pages back and forth just to make sure that I don't have any other questions that were.
Any questions in the social media?
Nothing in social media, no. Okay, but let me double check to see if I got.
This is very good. I wish more organizations, I have to say, kudos to you guys, because I wish more organizations would do this, in a more regular base, because it's needed. The community need to know, their options, and be aware that the scammers are out there, and be aware of that. Okay.
That was your question. That was that. Okay. Yep. That's all I've got. Uh, I have included links for some of the pages or some of the information that you were talking about in the chat. I will also include a copy of this recording for everybody that registered for you to go back to actually watch, along with those links for all those pages that you saw me trying to find, and then the link where you can download a copy of the Medicare book. that'll be on there as well. And then your contact information for
Yeah.
your agency if someone is interested in speaking with a counselor. Um, oh, okay. And then no comment on Facebook either. So yeah, I believe that is it. Well, thank you very much, Miss Guys, also for participating. I don't see anything else here. Make sure I didn't forget anything. No. Okay. So yes, I will make sure that all those links are included. I want to thank the Harris County Area Agency on Aging for being here to provide this information. If there are other questions that you all may have afterwards, or if you need some additional support, then please feel free to reach out to me and let me know, and we'll make sure that we try to get connected. If someone has missed the presentation or if they need more information about it, please feel free to share the links or have them give us a call so that we can forward the information to them as well. But again, the links will be included along with the link of the recording so that you can go back and actually watch the presentation as well. Also, we are in the process of planning for our 2026 schedule. So if there are any other workshops or any topics or anything like that that we don't currently offer that you guys need more information about, please feel free to reach out to us and let us know so that we can try to get that scheduled for 2026. But for our senior security series, we definitely will be coming back with our retirement information. We will be planning more transfer on deputy clinics. We will be hosting a few more variety of other different workshops and things like that we feel are beneficial to a lot of seniors. But we would love to have you guys' input on what it is that you would like, just in case I'm missing something or don't know, or if you guys are aware of what's more needed out there
Mhm.
for us to then provide for folks, then we'd be happy to more than to come out somewhere and actually and host the presentations again as well. So with that being said, thank y'all very much for participating, for attending, for watching. If you're watching on social media, thank you very much for watching. And we hope that you guys found the information to be beneficial. Again, we know that there are a lot of folks out there that don't have access to a lot of available resources, that don't know where to go to have their questions and things like this addressed, don't know what to do when they've come in contact with some kind of fraud or for scam. So we do hope that this information was beneficial and ask that you share it and pay it forward for someone else to have this information as well. So without further ado, we're going to go ahead and conclude this presentation. And again, thank y'all for coming out, and thank y'all for participating and and being here with us this morning. So thank y'all very much, and hope you all have a wonderful remainder of your day, and take care of yourselves. You stay safe, and we will see y'all next time.